My name is Sebastien Vante, and I am the Associate Vice President of Streetwork Programs at Safe Horizon. So I work specifically with runaway and homeless youth. We have 3 separate programs. We have a crisis shelter, we have 2 drop-in centers, and then we have a mobile outreach that goes out into the 5 boroughs in New York City, handing out safer sex supplies, information related to runaway and homeless youth programs. The model is a one-stop shop, so we try to provide as many resources on site as possible to kind of minimize the barriers that a lot of our young folks face in connecting to services. And it's important because, clients develop that trusting relationship with us as a program provider or a community-based organization, and we act and serve as like the liaison to connecting them to much-needed resources like healthcare and connecting them to Medicaid. And why this particular project is important to me is because it's about health equity, it's about cross-collaboration, and how CBOs and community health workers who are on the front lines serve as the liaison in connecting people from community to medical resources or social services. What gave me the calling to help people was, my junior year in undergrad. I had the experience of working with Outward Bound, which was for first-time college young folks, and they were on site on a campus, and they were taking college courses. And it was like my first time working with youth in this capacity, and I felt like this is where I want to be. Communication is super important in this field, especially if you're looking to build a trusting relationship with someone that you're trying to connect to resources. So it's super important that CHWs have the education, the knowledge to provide that to someone who is seeking medical resources. Before we dig in, allow me to give you some important definitions. Health equity is the attainment of the best possible health outcomes for all people by removing any barriers that folks may face. Poverty, your gender identity, socioeconomic status, where you live. My definition of a community health worker is definitely not the standard definition. When I think of a community health worker, I think of an electrician, like you're connecting people to power, getting folks to feel confident enough to access the resources that they truly need and deserve. And so community health workers are like the liaisons. They're the folks who are on the front lines. They're forward-facing. They know the community. They have that cultural competence. They have that cultural humility. Oftentimes, community health workers identify as part of the community. Cross-sector collaboration is sectors such as education, healthcare, and social services working together to identify the needs of this individual or the family to connect them to the appropriate services. So a perfect example of that is for someone who needs the medical attention, right, but doesn't have Medicaid. You need those CBOs or the community-based organizations that work to help enroll that young person or that family into Medicaid so that they can then be eligible to pay for medical services or meet with a doctor. You're going to need those wraparound supports. Community engagement is simple. It's working collaboratively with the community. If you're a medical provider, a social service provider, a community-based organization, you have to make sure that you're centering the needs of the folks that are in your immediate community. Part of how you do that is engaging with community members, holding tabling events, talking about the resources and the services that you provide, bringing in the input and the feedback of the community. For me, that feels like true community engagement. Now that we have these definitions out of the way, let's dig in a little bit further. I have a personal story. Let's call her Jasmine. 21-year-old young lady facing homelessness for many years, since the age of 17. It's kind of bouncing around from place to place, couch surfing, separated or disengaged from education at a very early age because they were just trying to survive. And now a single mom with a kid with very limited education and very limited knowledge around how to support her child. When she first came into our program as a CBO and a provider, one of the things that we tend to do is want to assess the needs of this person. It wasn't until she actually connected with a CHW who escorted her to her appointments and eventually supported her after she gave birth, and providing her with tangible things such as a car seat so that she could actually leave the hospital with her child. And then providing her that follow-up support around, like, you're going to need them to get vaccinations. You're going to need to go here and go there, and like literally walk through the plan with them and kind of handhold a little bit to the point where she would eventually feel confident in doing these things on her own. Of course, there were a lot of things that Jasmine had to sacrifice. If it had not been the support of a community health worker, right? And also the cross-sector collaboration and, working with nonprofits that can provide a car seat, working with providers that do, prenatal care, and all these resources that you need to really wrap around her as a support. I don't know if she would have had the same health outcomes, or her child would have had the same health outcomes had she have not connected with a community health worker. I spoke a lot about community health workers as being like the liaison, but they're not the only part of an individual's ecosystem, right? There are other folks that play an integral role in being a support to an individual, right? So it could be a religious leader, it could be an educator. We talked about, school. It could be the social worker. As a CHW, part of your role, right, is doing that community engagement, knowing your community, walking around, building relationships with trusted individuals, right? And really spread the word. And that happens with tabling events. That happens with going into the bingo hall, right? That means going into the community board meetings and introducing yourself and talking about the services that you provide. Because if you want to be seen as a resource, you got to know the people in your neighborhood, and they got to be able to trust you and want to come to you or seek you out or be referred to you by other individuals that you've made contact with. It's really on the CHWs to really do that engagement, to kind of make noise and say, hey, we're here, and we're here to serve you, and we're here to support you. Social dynamics and trust are super important for a CHW. Oftentimes, CHWs are representative of the community that they're serving, right? They live in the community. They look like many of the folks in that community. And that's something that's super important in building trust, right? Oftentimes, people gravitate to people that look like them, have similar experiences. And it's an asset for a CHW who is from the community in serving as an advocate and building that trusting relationship. Cultural humility is important in discussing pediatric vaccinations because many individuals, especially folks who are coming from vulnerable populations, Black and brown, have an inherent mistrust of the medical system, right? Have feelings about what it means to be vaccinated or what vaccinations are. As a provider, as someone who's trying to connect someone to vaccines, you want to create a space where folks can talk about their hesitancy, can talk about their discomfort, while also providing them with factual information, dispelling myths, and real tangible resources in getting them to connect to vaccinations. You have to really connect to the person in front of you, and you have to be consistent, right? Because if you're expecting to engage with an individual and for them to change the behavior or to do exactly what you're encouraging them to do right away, then you're already behind the ball, right? You want to be able to listen to that individual. You want to be able to provide them with the information. You want to hear their resistance. You want to create a space for them to share those things. It's part of being, culturally competent, and the cultural humility is like allowing that space for that person to say, well, I don't know, I don't like doctors, and you can't say, no, doctors are great. You got to create space. Yeah, not all doctors are the same, right? There are some folks who have a different affect than others, right? It's about finding the appropriate provider. Let me support you, and in connecting to a provider that you feel comfortable with, and that's the role of the CHW in being the liaison and being the advocate for that person. We have to check ourselves in making stereotypes and assumptions around what someone knows and doesn't know, right? And I think that's where cultural humility plays a huge part in providing that space for a person to share their concerns, to talk about what it is that they need, being very much client-centered, is super important, because you don't want to make assumptions, because you might see someone and feel like, oh, they don't need support around this or that, but without actually getting to the root or hearing the person out, how would you know? And I think that's part of building that trusting relationship. So bringing it back to Jasmine, let's look at all the ways the trusted leaders wrapped supports around her to get her to a point where she could get her child vaccinated. Some of those examples would be providing her with the tangible car seat. She could have known everything there was to know about vaccines, but she didn't have the means to take her child to get vaccinated. Providing her support in connecting to Medicaid so that she could actually go to medical providers and receive ongoing medical care for her and her child. She had a very strong connection to a particular church, and it was that church's religious leader that helped connect her to our program for some of our resources, such as childhood vaccines. The CHW was able to provide Jasmine with the necessary education and information to support her in making the right decision around vaccinating her child. And they did that by cultural humility, educating her, building a trusting relationship so that she could feel comfortable in expressing her hesitancy, but also in connecting her with the appropriate resources and supports. Thank you for listening. Please join us in creating an environment where pediatric vaccinations are more accessible for everyone.